Welcome back to We Are Austin. As we close out Breast Cancer Awareness Month, there has been a lot of discussion about when women should start getting mammograms, but everyone agrees that screening is a must. Dr. Randal Aschenbeck with ARA shares with us why ladies may want to think about 3D mammography. Thank you so much for being with us this morning.
Thanks for having me.
So we've been talking about this term a lot throughout the month. Can you help us understand the difference between 3D mammography and conventional mammography?
Sure. So conventional mammography, they basically take a single image of the breast in different positions. With the 3D mammography, we're able to take very low radiation doses throughout the breast.
Okay.
And so what that does is, if you think of the breast as a book, we're able to kind of page through the breast. And so we're able to see small masses or scarring or anything else of concern in the breast a lot easier.
Okay, so that's definitely a benefit. What are some of the other benefits for patients?
One of the major benefits is, as I mentioned, we're able to increase our cancer detection rate by about 40%, which is not insignificant. Another benefit, probably just as important, is we're actually able to decrease our recall rate.
Oh, wow.
So women do not need to come back for additional images as often as with conventional mammography, yes.
And so at what age should someone start getting these screenings, and how often is being proactive enough?
Yes. So the American College of Radiology and the Society of Breast Imaging, based on an extensive amount of randomized controlled trials, still recommend that screening be performed starting at the age of 40 and annually. There's no cutoff at age 50 or age 55 or anything like that. It's 40 and annually. There is a small percentage of women that actually do need to start mammography earlier, but that's something they should talk with their primary care physician about.
Okay, and this visit, if you're going to have 3D mammography, what does that look like? How long does the process take? Is it uncomfortable? Can you kind of paint us a picture of what that looks like?
Sure. So with mammography, as with standard mammography, compression is very important, so we still have to do compression. But there's really no change in the conventional mammography and the 3D mammography. It takes roughly about the same amount of time.
Which is?
It's only a few seconds per projection.
Gotcha.
Yep.
That's good to know. And you know, we talk about this month, we're encouraging people to be super proactive, but the truth is it shouldn't just be a month. You know, you should be thinking about your health all year long.
Exactly.
Are there parting tips you want to leave people with thinking about today?
Well, there are some important things I do want to talk about also with 3D mammography. One is the radiation dose. The radiation dose, at ARA, we have access to kind of the latest technology, and so we are able to perform this 3D mammography with similar radiation to the conventional mammography.
That's good.
Which is still extremely, extremely low dose.
Yeah.
But as you said, yes, it's a year-long process, breast cancer screening. So don't just wait until October to do it. Do your monthly breast exams and come see us once a year.
Well, thank you for that information. If someone's listening and they're thinking, all right, now's the time, I've got to make an appointment, get in there, what's the best way to do that, and how can they find you?
The best way to do that is you can go online at www.osrad.com.
Okay.
And you can also contact our scheduling department at 512-453-6100.
Thank you for being here, and thank you for the work that you do to keep women healthy and informed all year long. We appreciate it.
Thanks.